All right, good morning. And we're here on the Today Show. No. We're going to interview some of our patients who are having surgery this morning. And we'll have you back tomorrow if you do well.
Okay.
The patients who have problems with it, like Ms. Casillas, no way, you're not getting out of me. So we're going to talk to you a little bit this morning. You were in our wacky clinic yesterday.
Yes, it was
And,
very nice.
Were you okay with that?
Oh yes, I got a lot of information out of it. A lot of information.
We have to ask that because, you know, it's not like a normal doctor's visit.
No, I like
make
this,
me an abnormal
kind of
doctor?
visit.
But you were in the middle of a crowd of people.
Yes.
And we had a lot of our post-ops from last week.
Yes, we did. Yeah.
And we did hear, I mean, some of them had some aches and pains.
Yeah, very little. Very
Yeah,
expected. Most.
There was one who had some nausea, remember her?
Yes. we
So
did.
that can happen. We don't like you to have any problems at all, but I think overall, I think they did pretty well.
They did very well, I
Yeah,
think. Yes.
yeah. And we had our one lady with the type 1 diabetes. I thought she looked wonderful.
Yes.
Her hair all done up and gold blouse.
And I'm very surprised with the type 1 because, you know, that's something that
Right.
doesn't go away, and she.
So we helped, but we didn't cure it.
Yeah.
Right. But you, we got slated for cure, right?
Yes.
Yeah, okay.
Yes.
You had a lap band
I had a lap band put in 2006.
and did great for a while.
I did great for a while. I lost like 130, and I wasn't in 132, and I did have a lot of throwing up.
All the
episodes.
time, or just later on? You did
Later
well?
on, I did good
You
at the
did
beginning.
great for a couple of years.
Yeah, a year, I would
About a
say.
year, okay.
And then
All
I
right.
started, but, you know, the band was tighter, and, you know, I started to do the throw up. I didn't really want to say nothing.
So you
Because-
kept it. You're tough.
No, I'm tough.
You kept it to yourself. Is that?
Yes, he was.
She's a tough cookie, not a complainer.
No, never complained. I
But
try
you
to-
said nothing feels as good as being thin. So you're
Yeah.
okay with the throwing up.
Yeah, I was okay.
Here's what the data around the country and around the world is showing: that the lap band works pretty well for a while, and that over time it starts to fail.
Yes,
And that's kind of what you had. So the data from Europe shows that at 2 years, about 80% of people who have a lap band are doing great.
yes.
By 5 years, it's about 50-50, and by 10 years, close to 100% of people have got trouble. Thank you. So that you kind of fell into that, is that right?
Yes, 3 years.
About 3 years,
Yeah.
trouble started really.
In 2 years, I developed that acid reflux. I mean, when I say it was bad, it was very bad. The burning, even when I went to sleep at night on my side or something, the burning was terrible. I just sat in a recliner chair and went to sleep. Because I just
But you were
couldn't sleep
130 pounds, so yeah, I'm going to live through it.
and I'm going to live through it. And I know,
I don't care.
and you know, I know some people say to me that was sick because you can develop esophagus cancer.
Well,
If the
that's
bird-
true, yeah,
mine
but
was
I don't
very
think you
bad.
were bad. You were. I mean, this is what
was
America's
bad.
built on: strong people who are not complainers. And you had something that was kind of working, and you toughed it out. I don't. You were kind of saying this yesterday. I don't think you should criticize yourself. You had a good doctor who said this is a good choice for you,
Yes.
and you were trying to make it work. You're not a baby about it. You were strong and tough, and now it failed. And we don't want to. We don't yell at the doctor. We don't think he's a bad guy. We don't think the band people are bad people. We just think that it could be that in some cases the band kind of tends to fail, and that's too bad. But you certainly tried.
I certainly tried, and to no avail. I had to have it removed in 09,
Yep. And now you gained your weight back.
and within a year and a half, I have gained all my weight. I mean, 20 pounds shy from what I started from the beginning.
And so we're going to do a MGB.
MGB, and I went online not to find this.
No.
I went because I was trying to do research about the band, like all the bad things about it, because I was trying to fight with the insurance company and trying to get, you know, documentary. And then I found Dr. Rutledge on
You
it.
say bad band on Google, Dr.
Yeah.
Rutledge's smiling face shows
And he
up.
was there, and I listened, and I have gout. I have chronic gout, too. And I listened to everything you said, and I was...
And now you're contributing. Wave out there to all those
Hi,
people.
everybody,
So
everybody.
this is the unusual part. This to me sounds really goofy. We think that YouTube and the internet help take care of our patients. So somebody might watch this video and learn if they might be struggling. Here's what I've heard from my lap band patients. I go back to my doctor, I'm vomiting, I'm not losing weight, I've got reflux, and what does the doctor say? You're not chewing your food well enough, you're not following our advice, the band is working great, you're a bad patient. And so maybe somebody out there listens and they say, hey, maybe it's not me, maybe it's the band has got a problem. And not to be critical, there's nothing perfect in the world, right? It's Casillas, right? Yeah.
It's true. When I heard all the other people on the YouTube and on the internet, it did help. Yeah. I didn't feel like
you're a bad person.
Yeah, that I did something wrong and I got
and if you think about it, you're putting a plastic belt around your stomach and your esophagus.
Foreign.
What could go wrong? Right? Yeah. Okay. All right. Well, now you're wonderful to share that. You're very kind. We have your permission to show you in your lovely outfit all across the world. We haven't identified you, have you? You're Miss X?
Miss X.
Miss X, okay. Yeah, you're part of the acting crew that we bring in from Cirque du Soleil to... Now, so you were kind enough to share that, but what about questions left over that you and I did not get answered for you yesterday? Is there anything that we should talk about today?
There's one. Will you use the same incisions that I have?
It depends.
Okay.
In other words, what we want to do, we want good cosmetic results. We want you potentially to be at the beach in a bikini, just showing off that new hot body on the Sports Illustrated cover.
Oh yeah, my dreams.
Right? But more importantly is your health and safety. So if I need to place a port so that I can maneuver safely, I'll probably put up with the slight, decrease in cosmetic result if we move that port a little bit so I can have the best opportunity to do your surgery well and safely. I don't think if it would make you look prettier, you don't want me operating, twisted over like this, because you want your surgeon to be at ease doing the surgery. So oftentimes there are some ports we can use, but we're not going to get confused about our priorities. Your safety is number one, and your beach body is slightly number two. Now, having said that, we have done surveys of our patients, and our little ports at 3 years, 78% of our patients say they're invisible or barely visible. And so I think you're going to be happy with our cosmetic results. We do pretty well.
Everything I see about you, Dr. Rutledge, I love. I just censor you.
What was that?
Really, you're very down to earth.
Yes, that's
you
right.
are. You're just.
Other people say annoying, but I like down to earth much better. You're very kind, and that's smart. Talking to your surgeon right before surgery. You don't like.
And I'm the first one.
Right. This is not the time to point out his faults. Probably not. So we had a patient. She said, as she introduced herself, she says, "I am a web page designer." Remember clinic yesterday?
Oh, yes.
So we're going around saying hi to everybody, and that day, I forget why, we're just asking, what do you do? And she said, I'm a web page designer, and I think your web page is terrible. And I said, well, I'm your surgeon. I don't think I would have said that. At least till after surgery. I said, but you're right, it is me. But we kidded around. But what about questions left over besides that? Anything else? What about talking about the length of the bypass? You want to talk a little bit about that?
Yes, I hear so much about 6, 7.
I was waiting for you guys to bring that up. It's the most embarrassing question I get, because do you think it would be inappropriate to blame God? Probably a bad idea. Just a suggestion. Look, here, first of all, let me give you some background. Everywhere else in the world, if you go for a bypass, the length of the bypass is not in the discussion. In other words, basically everybody gets a bypass is a bypass is a bypass. They're not busy on the Roux-en-Y websites going, how long did Dr. So-and-so bypass? Because most surgeons in the world believe that the bypass length doesn't make any difference. To me, that's crazy talk. And you can look at my staff. So Trish, you met Trish?
Yes, I did.
Trish, before she had surgery, was around 250 or 260. had a bypass of 6 feet and lost down to 180, and then we added to her bypass, and now she's like 120, and she's 10 years out. Okay, so we changed the length of her bypass, and her weight changed.
So you went back.
She had a revision.
Revision.
She had 2 surgeries.
Okay.
Sandy is infamous because out of our 6,000 several hundred patients, she has had to see me in the operating room 4 times. But it's very instructive, although it's embarrassing, it's very instructive to hear about her weight and the length of the bypass. So now she always corrects me. Usually I'm off by like half a pound, and she'll chime in and say, no, that's not right. But her starting weight was
230.
230. We bypassed 6 feet, and she got to about 180. Closer. What was it?
It was 178.
All right, so we bypassed 6 feet, she got to 178. Okay? So, after about a year, she said, let's do a revision to get more weight loss, because that's almost the same thing that happened to her sister Trish. So we added to her bypass 6 feet, and she got down to almost like 98 pounds.
Wow.
So 12 feet too much, 6 feet too little, and she started to get a low protein and have problems by losing too much. Again, whose fault was that?
It was yours?
Yeah, it's my fault, because I didn't know, not that I don't like her, I love her, but I was not smart enough to know how much to bypass. So now she's too thin after 2 operations with me, so we went back, and because she was sick, we went back to 3 feet of a bypass. So then she gained back to about 165.
Yeah, 166. You want to know what it was on my thing?
All right, 166. And just, how long ago now?
2 months, January 6th.
So on January 6th, we went back and added 5 more feet. So now she's right between 6 and 12 at around 8 feet. Is that right?
Right. And I've lost some contact over like that. I'm in no rush to.
So what we've got here is, first of all, this is my failure. So I am embarrassed and apologize. Not because I don't want the very best for Sandy or for you or for Trish, but when God created heaven and earth, now here's where I try and get out of trouble by blaming the Lord. Not because I didn't want Sandy to have a perfect result. I desperately want her to have a perfect result. She's here in front of my patients every day. I wish she was doing terrific with 1 operation. But when God created heaven and earth, I personally, if you were to ask my suggestion, a little marker on the bowel, cut here for 100 pounds, here for 150, here for 200, maybe color-coded, right?
Why not, right? So.
But there's no markers. So at the time of your surgery today, I have to guess how much to bypass. I mean, I have to use my judgment. And that is really embarrassing because, as Sandy shows, it's hard to guess exactly right. Now, we have thousands of people, over 6,000, and we've guessed right, like Sarah, right?
And my son and my daughter and my niece and my dad.
And Dad, right? So we've got good luck in a lot of people. We think the length of the bypass is very important. And we could know some other tricks. One is, guys don't necessarily want to be as skinny as women. So we don't sometimes bypass quite as much in men, because men are not usually dreaming of being on the beach in a bikini. Yeah. Good. Okay. Another thing is, older people can't take the stress of a massive bypass as easily as somebody who's thinner. So if we're older patients, we're a little more cautious. For diabetics, we'll often bypass more because we hate diabetes so much. We feel diabetes is such a deadly, serious illness that we'll often bypass a little bit more, even if some of those patients might end up being a little too thin. We think occasionally that's a fair trade-off if we can get rid of the diabetes in people.
My sugar was up today.
Yep, right. And there's one other trick that I know that not everybody else in the world knows, and that is lap bands mess you up.
Yes, I do.
So what we found is if I bypass the same amount in a lap band patient as somebody without a lap band, they lose less weight. So there's something about those years of throwing up and eating the funny foods and all that affects you. And so if you take my advice, I think we should bypass an extra foot if you are a lap band patient, because what I found is those patients lose less than we would like. Now, having said all that, I don't know what I'm doing. And that's a really embarrassing thing to say. I know that most of the time my judgment on bypass is superb. And most of the time I help people, and most of the time the results are excellent. But I don't know precisely how much to bypass, and there is a risk that I could bypass too little or too much in your case.
I understand that. Do you go by like what you did in the past with somebody? Let's say somebody with my weight, my height, and diabetes.
Yes, because if you think of your weight is 230.
Yeah, well, 220. Yeah.
222.5.
Yeah.
So that's close to where Sandy started. So I would do, without your diabetes and without your band, around 6, which is a big bypass for you. With the diabetes and with the band, I might even think of going a little towards 7. But that's a pretty long bypass, and people who get 7 could get too thin. So you can kind of give me some guidance on, should I be more aggressive or less aggressive? Or
I would say be more aggressive because, I mean, I went through this of, you know, like being 130. I've done things things I've never done in my life. I went hiking and, you know, I had the energy of, you know, and I work. My job is I work with young people who are mentally challenged, and I take care of them, and I'm always, you know, getting them on the, you know, the van, taking them out. So I'm a very active person, you know, even heavy, I'm very active. So I think for me, and with my diabetes and my family history, we had amputation and the band before. And I have to say that band, I don't know, but when that band was removed from me, it looked like it was my weight was just coming on. Someone told me that my body was starving, and that as soon as I did have nutrition, I don't know if that's true.
I think you're right.
That it went right away.
Jumping back to where it was. It's like you were on a long diet and stopped the diet. All of a sudden, boom, everybody been on a diet. As soon as you go off the diet, boom.
I remember coming home from the hospital. I went into the hospital at 1:38, and I came back at 1:49. So, and then I got depressed, and then the weight just. But
so between 6 or 7 is what we're thinking. It depends on some other things we'll look at the time of surgery, but that's what I would think if that's okay with you.
That's fine with me.
Okay. Other questions? Anything else?
No, I've read up with it. I read everything, did the notebooks, all your wonderful video, went through all, and speaking with everybody, I really feel that I know.
You're ready, set?
And Sandy is wonderful. I have to say, she's
Don't
like
tell her that.
She's that calming person on the other edge of the line, right?
That's going to go right through. You know, I have to work with her today. It's going to be all. All right, very good.
All right,
thank you so much.
Doctor. Thank you.